Hi, I'm Ashton. Long time no see. Turns out college plus part-time job is like more time per week than a full-time job, and you can't have any hobbies when you do that. My apologies for the fact that I need to cut my hair and my underwhelming, uncharacteristically boring makeup, but this is not a video where I sit and look cute. This is a video about my internal organs. So the day that I'm filming this is December 9th, and I had a hysterectomy on August 16th, which is almost 4 months ago. I am completely healed. I have no more restrictions. I'll talk about the timeline a bit later. But yesterday on my Instagram story, I asked what you all would be interested in hearing about my hysterectomy experience, recovery, all of it, anything related to it. I believe I will be answering every single question that I receive. I'm not going to be putting your questions like up on the screen like I typically might for a Q&A because I got a lot of questions, more than one. My central disclaimer that I want to say before I start this video is that I am not a doctor. All the things that I say are from my own knowledge of my experience or things that I have read. Please do not take anything that I say as like medical scientific fact. That is a bad idea. All of that being said, this video is kind of being split by me into three sections. So I'm first going to talk about the background, which are like the why did I get it? Was it hard to get insurance stuff, etc. And then I'm going to talk a bit about the procedure itself, and then I'm going to talk about recovery. So if you only have questions related to one of those three specific timelines, if I remember to, I'm going to timestamp those three sections so that you can skip to whatever section you are interested in if that is something you want to do. Background. Why did I get a hysterectomy? If you're new here, I'm transgender. I had a uterus. I have other parts that people assigned female at birth typically, but not always have. And I didn't want a uterus. I didn't ask for that. And I got rid of it because I can. That's an oversimplified way of looking at it, but I had a lot of dysphoria surrounding having a uterus inside of me. It oftentimes made me feel wrong. I got a lot of cramps even when I wasn't getting a period, which I'll talk about more later. My periods, when I did have them, were incredibly heavy to the point that I, like little t traumatized by them. I would bleed through multiple pads and tampons per hour. The longer that I've been on T, like the more my existing dysphoria has centered on having a uterus. I do have generalized anxiety disorder, and if you also have anxiety, you'll understand this. I kind of have like this baseline level of anxiety. A significant portion, like not a lot of that anxiety, but a notable portion of that anxiety was tied to having a uterus. I worried about it a lot. I did not want to become pregnant. I hated having periods. It caused me a lot of dysphoria, and I was like, there's a surgery that can fix this. So that's, I guess, the basic why. I'll talk a little bit more about my decision process in getting the exact type of hysterectomy that I got a bit later on. The next question that I got a lot was it hard to get doctors to listen to me or approve me getting a hysterectomy? A little bit, but in a bureaucratic way, not in a the doctors suck way. The doctors that I went to were, for the most part, very, very good and inclusive. It is just the systems surrounding the doctors that makes it difficult. And this is true for so many systems and so many people. The place that I went to did surgery through informed consent, which means that they talk you through all of your options, all of the risks, everything that you as a patient would need to know about getting a surgery like the one that I got. And you, alongside them, decide what you want, and you get letter of recommendation, essentially. That's not the term for it, but I'm like mid-grad school applications right now, so that's what's on my mind. You essentially get a letter of recommendation for your surgery, where two people, at least, that have medical caretaking of you. So I did my previous therapist and my current general practitioner. This person knows what they want, and they want surgery, and I think as a medical professional, they can get it. Those had to be sent to both the surgeon's office and my insurance company, which was kind of a kerfuffle for a while, but I figured it out. So it was not hard for me to get doctors to listen to me because I already had a GP that is experienced with trans patients and was like, I will refer you to a hysterectomy. You don't, like, I don't care. Here's a doctor that I know is good with trans people. And she was like, yeah, if you give me those letters that I need to, like, legally perform a informed consent style surgery on you, then I will give you surgery. And I was like, great, wonderful. I guess that's a long way of answering the question, but I feel like it's all interesting and like helpful context. It is rarely the people that are the difficult part if those people are trans affirming and good doctors. It is the system surrounding them. However, good doctors oftentimes know how to navigate those systems and can definitely help you, and you should definitely ask any questions that you have. Someone also asked how difficult it was to schedule, which is a really interesting question because I feel like people who have not had semi-major surgeries might not understand this aspect of it, but there is, when you live under capitalism, right, this gray area of like, I want this, but I'm a full-time student. I have a part-time job. Like, I need to be able to schedule this thing so that I can have time to recover before I need to be doing things again, which can be a difficult dynamic. I had a solid week off of school. I got it done literally the second day of classes. So I went to class the first day of school, and then I didn't go to any other classes for a week, but I emailed all of my professors beforehand. I did choose to get it done in what is colloquially referred to as syllabus week, so that like I wasn't actually missing any class work. So it was a little bit difficult to schedule. Surgery can be difficult to schedule when you are trying to survive under capitalism, but it was manageable. My surgeon was relatively flexible, and it all ended up going okay, but it is definitely something that you have to think about when you are trying to schedule a surgery. I was also asked a couple times whether people on testosterone long-term need to get a hysterectomy, and this is something that has kind of changed recently-ish in like the transition healthcare field. From my knowledge, again, I'm not a doctor. This is stuff I've learned from my doctors or like science articles on the internet. Please do not take this from my mouth. Please like do your own research if you are applying this to your own healthcare plans. Yes? Okay. So I was asked whether people on T in general need to get a hysterectomy, and also whether everyone on T long-term should get a hysterectomy. My answer to that is as follows. No. About 5 to 10 years ago, it was considered common practice to highly, strongly recommend anyone on testosterone long-term to get a hysterectomy. That practice has changed because of a lack of certainty, a previous lack of certainty about testosterone's impact on the reproductive system. There was mixed information about the prevalence and intensity of vaginal atrophy that testosterone can create, which can be related to the risk of getting a hysterectomy later on. There was not very clear information on testosterone's link to different types of reproductive system cancers. There was just not a lot of information because science doesn't care about trans people frequently, right? But from what I know, testosterone as a masculinizing form of hormone replacement therapy is no longer considered a risk increaser for cancers, if that makes sense. And hysterectomies are no longer a strongly recommended surgery for anyone on masculinizing HRT long-term. It is now instead something that you can choose to get or not. Your doctor may or may not recommend it for you based on what they know about you, but it is generally something that is a personal choice and not something that is like strongly medically recommended, because what we used to think could be the risks of testosterone. I also was asked, have I thought about pregnancy and how did I become sure of my decision because of my age? This kind of rolls back to what I was talking about at the beginning of the video. I did not want to be pregnant. It caused a lot of anxiety. I am only 21 and that could potentially change my life, but the amount of anxiety that I had about it, and the fact that I know myself relatively well, I knew that was probably not going to change. I don't want to carry a baby. It's not something in my future. Even if I change my mind in the future, which I don't think I will, there are other methods of parenting. There are other ways that I can be involved in the life of children that is not birthing one out of my own vagina, which is not something that I want. On top of personally not wanting kids, I also personally am not comfortable bringing a kid into the world that currently exists, and I would rather my contribution to society be one that pushes towards a better world and not one that puts a child in a situation that I think is, like, at its core unjust. You didn't come here for an anarchist rant, but you're welcome. I was also asked if my insurance covered any of it. Yes, another reason that I wanted to get a hysterectomy in this time frame is that I'm still on my parents' insurance because I'm a college student and I'm young enough. And when I graduate and become a graduate student, hopefully, there is no guarantee that my insurance will cover it. So that is a part of why I chose to get it right now. I personally, as an individual, would not have been able to get it if I didn't have insurance help paying for it. I talked a little bit about that process earlier too with the letters of recommendation that I had to send to my insurancing. Depending on your insurance, you might have to get it pre-approved. I did, so I had to send them a bunch of paperwork before I got surgery so that they could be like, yes, we will cover it, or no, we won't. They did. The next question was how I found someone to do it, and how I found someone to do it that would clear it, because some surgeons won't do it without having without the patient already having had kids or like having some sort of spouse approval. I definitely am very thankful for my general practitioner because she knew people that would do it. If your area has a like strongly connected medical system, like I did all of mine through my university's like hospitals system. I'm not entirely clear on how that whole system works, but it worked for me, so I'm not complaining. So my general practitioner referred me to a gynecologist because specifically she knew that this OBGYN had done surgery on trans patients and would do surgery for me. I believe that the surgeon that I went to also will do it informed consent style for cis women, but I'm not entirely certain on that because I did not have that experience. She did ask me about my current partner and like my child plans, but I think that was more of a formality in that she wanted it in my chart that I didn't want kids. The best way to find informed consent practitioners is either if you already have an informed consent GP or a GP who specializes in trans healthcare, they probably know other people. There are networks for that. Or if you know trans people in your area who've transitioned, ask them where they went and ask what their experiences were like. That's the best advice I can give you on that. I was also asked, did the surgeon use inclusive language? And yes, she did. She did in person. She they'd me a few times and he'd me a few times, which was great. The only like inclusivity issue really was if you've had surgery, you probably have experienced this where they give you like a big packet of like, here are some coping strategies for pain after your surgery. Here's what you should expect after surgery, like a list of medications you're on, etc., etc. That packet had very cisnormative language in it, but it was fine. I read it anyway. It doesn't surprise me, and I think if you are planning on getting a hysterectomy, even with a provider that says they are trans-inclusive, you should more or less expect that at some point they will give you materials or reference other patients or like do something that makes you as a trans person a little uncomfortable. You just gotta be prepared for it all the time, and I'm so sorry that that's the way that it is. The last question on the background part of this video is, was I concerned about heart disease? This was a question that I was like, I don't think so, should I be? But I did some research on it, and there was a study theorized that hysterectomies could increase the risk of heart disease. It was a very small sample size. The study was done specifically on total hysterectomies, which is where they take out the uterus and the fallopian tubes and ovaries. Those are the things that create hormones, more or less. Again, this is simplified, and I'm not a medical professional. Heart disease risk can be increased when you don't have enough or a good balance of sex hormones, typically referenced to as estrogen and testosterone. There are more sex hormones than that, and it's more complicated than whether or not those are sex hormones, quote unquote, but you get what I mean. The type of hysterectomy that I had will not increase my risk for heart disease because my hormones are unrelated. The uterus itself does not create hormones. The ovaries, as do like some areas of the brain and different glands throughout your body. But the uterus being removed will not impact any of that. There's more I could get into on like the intricacies of this argument, but long story short, I'm not worried about heart disease. Okay, the procedure section is the shortest section, but I think the section that I might have to explain the most about. So a lot of people asked, understandably, did I get a full hysterectomy with my ovaries removed? Why or why not? What nobody asked is whether or not I got my cervix removed, which I am going to tell you. That would be a great clickbait. Like, do I have a cervix? The answer may shock you. Again, I am not an OBGYN surgeon. I'm simply not. I never will be. I don't think. That's not in the plans. Depending on how much you know about reproductive systems, this may make more or less sense to you as a person. But I'm going to explain it the way that it makes sense to me, and if you don't understand, you can do further research. I will link an article below on the differences between different types of hysterectomies, if that is helpful. I got what is referred to as a supracervical hysterectomy with preservation of the fallopian tubes and ovaries. So if I were to draw a little diagram of like a uterus, then there's the vaginal canal, between them is the cervix, right? And then like kind of out the side top, you've got the tubes and the ovaries. The only thing that was taken out of me was my uterus. And it was taken out through my belly button, which is sick. It was sick in a cool way. I had a laparoscopic surgery, which means that robots helped, and they put little cameras up inside of me. And the reason that I chose to get that type of hysterectomy is multifaceted. So I chose to keep my ovaries because they were not causing me dysphoria, as well as for future potential hormone change reasons, which I will explain in a bit. My uterus gave me dysphoria. My ovaries themselves didn't give me dysphoria. I don't really care about them. They're not what's giving me cramps, right? So I was like, take them or leave them. The easier, more like simple surgery is to leave them, right? Obviously, if you're given the choice of, oh, take out this much or take out this much, it's going to be easier to take out this much, right? Not that the ovaries are that much bigger than the uterus. It's all connected. You get what I mean. An option that I did not know as much about before booking my consult was that you can also keep or remove the cervix. The cervix is like a little hat on top of the vaginal canal. It is where the vaginal canal attaches to the uterus. You can take it or leave it in a hysterectomy, but there are differences. So a supracervical hysterectomy, which is what I had, leaves the cervix intact. So I still have a cervix, which again, similar reasoning to my ovaries, but slightly different. My cervix was not giving me dysphoria. Additionally, if you leave the cervix, there is more structure in the vaginal canal, so you have a slightly lower chance of any sort of collapse or prolapse, which is a pro for me. It also makes the recovery slightly easier because there are not internal stitches keeping the top of your vaginal canal together. And as someone who's had surgery complications in the past, I was like, the less chance of complication, the better. You can leave my cervix. So the cervix is like a non-negligible, helpful structural implement in the vaginal canal, from what I understand. And that is the main reason I chose to keep it. Additionally, if you keep your cervix, you have a lower chance of bleeding and spotting after the surgery, which is great because bleeding is what caused me, the dysphoria in the first place to want to get surgery. So I was like, the less of that, the better. Hello, excuse my editing outfit, which is currently a frog onesie. I can't believe I forgot to talk about pap smears. I guess it's because no one asked and I didn't write it on my script, but another major reason that I decided to keep my cervix was that I can tolerate pap smears pretty easily. I hadn't had one until my pre-op for my hysterectomy, but it was a part of the decision process. A, they wanted to get a pap smear because I hadn't had one, and B, my surgeon was like, if you don't mind this procedure, then it would be a plus of keeping your cervix, because it is something that you continue to have to do. If you keep a cervix after hysterectomy, you do still have to get pap smears. But since I didn't mind it, it was not that bad for me. That was a part of my decision process, if that makes sense. So if you've never had a pap smear and you want a hysterectomy, that is something that you should consider and something you should talk to your surgeon about. But for me, I didn't mind the pap smear too much. And because of other reasons that I explained in this video, I decided that it was worth getting a pap smear every year to have these other benefits. Also in this section, I have the question, potential long-term effects that I am worried about. None. That is one of the reasons that I chose to keep my ovaries. The ovaries are largely, the thing that produces estrogen, and everyone needs estrogen and testosterone in their bodies. It's just the balance of them that activates different types of chromosomes. I'm not a geneticist. And then I also wanted to talk a bit more about the hormone part, right? So people asked, how does having hysterectomy interact with hormone replacement therapy? Is dosage affected? And do I now have to stay on testosterone forever? This is another large reason why I kept my ovaries. I will not have to stay on testosterone forever. I might, but I wanted to leave my options open, so I kept my ovaries. Like I was saying, you need a balance of sex hormones in your body. It would not be good to take out your ovaries and not be on testosterone. It's okay, you would likely be fine, but it does increase the risk for things like heart disease or bone density issues, or a plethora of other things that are influenced by sex hormones that you wouldn't think are influenced by sex hormones, because we call them sex hormones because we are so fixed on having this sex binary that doesn't actually exist, and hormones actually do much more than masculinizing or feminizing effects. Crazy how that works. It's almost like medicine would be more accurate if we let go of the gender binary. So no, because nothing in my reproductive system's hormone production things have changed, my testosterone dose has not changed. I haven't had labs done since I got my hysterectomy, so it's not like I know for sure that's a fact, but in terms of the way the body works, it didn't change anything, probably, most likely. So all good on that front. To kind of sum that up, without a uterus, your hormone balance is likely not going to be affected. Without ovaries, your hormone balance is more likely to be affected. The last question in the procedure section is about catheterization. They asked, did you have a catheter right after surgery? And yes, I did, but I did not have to wear it for long when I was awake, and like, as soon as you're out of the hospital, no catheter, you're fine. Again, this was my experience. Different surgeons might do surgeries differently, and that's fine. So directly after surgery, pretty much as soon as I was lucid, they used a sort of reverse catheter to put water into my bladder. Then they took the catheter out and made sure that I could pass that water. So like they had me go to the bathroom and I was like, hey, I peed. And they were like, sick, great, wonderful. You're free to go. The uterus is typically situated right next to the bladder. They want to make sure that nothing bad happened in the area that was right next to the area that they were working around, right? So before they let me leave, they're like, you are not bleeding, correct? Good? Okay. No blood in the pee is a good thing. Okay, let's talk recovery. I'm first going to answer two, like, unique questions that I got, and then I'll get into general recovery information that a lot of people asked for. First, someone asked, do I take anything for bone strength? Good question, but unrelated to my personal surgery. So I think this question was asked because of the whole hormone balance thing, like I was talking about earlier. If you don't have any estrogen in your system, it can be a little bit risky for your bone density for some people. There are other things that impact that too, obviously. But a fun fact is that when you are on testosterone, your general practitioner, endocrinologist, or whoever prescribes you the testosterone should have you get a bone scan. And you should have one, I believe, every year or two. If you are not being given them, you should talk to your doctor, request one, and if they deny it, have them mark it down that they denied it. Because your bone density can change when you're on testosterone and your sex hormones change, and that can be dangerous. I have had my bones scanned more than once, more than twice. My bones are fine. Nobody needs to worry about it. I got great bone. I don't have that good of bones. I'm not like bragging about my bones. I have pretty normal bones, I think. The second fun, unique question was, did you keep it? They are referencing my uterus. Did I get to keep my uterus in like a wet specimen jar or something? I assume that you asked this because I kept my wisdom teeth and was very open about that and happy about it. I did not get to keep my uterus. So sad, I know. But because I had a laparoscopic surgery, everything was done with minimal, like, insertion possible. And because I kept my cervix, they could not take my uterus out through my vaginal canal. So instead, they cut up my uterus into, like, a little worm and pulled it out of my belly button. So because my uterus was cut into a worm, it wasn't really in a state to be preserved, right? So no, I didn't get to keep my uterus. So unfortunate, I know, but worth it, I guess, because I would rather it be in a medical incinerator somewhere than inside of my body. However, I did get to see pictures of my internal organs. When I went for my follow-up appointment, my doctor was like, oh, did you get to see the pictures? And I was like, no, they never sent me the pictures. And she was like, here's your gallbladder, here's your stomach, isn't that cool? And I was like, that is so cool, thank you, bestie. And she sent the pictures to me. So now whenever anyone wants to see my gallbladder, I got a picture for you. I'm not going to send them to any of you. That would be weird. But I got to see them, so that was pretty cool. Okay, now into broader recovery questions. Nobody asked what the scars were like, which is so sad because I think scars are really cool. I'm now going to cut in multiple videos, potentially photos, of my abdomen after surgery. I'm putting on the screen the dates that these were taken so you can kind of see the progression. I didn't take a lot, so there's not that much, but these are not super gory. There is clear incision marks and some scabbing and quite a bit of bruising, but it's not particularly gory. But if you want to skip over it, this is the timestamp that you can go to not view that. So this was the day of surgery. You can see the markings. You can also see the shaved patch around my belly button where they had to pull my uterus out from. So I had 4 incisions. You can see all of them except for kind of the one inside my belly button, but you know. This was the only comfortable way to wear pants, and I thought it was funny. So there, you're welcome. This was the day after surgery. You can see that the swelling has already gone down a little bit. The bruising is starting to develop though, and then you can see the bruising continue to develop, and there is still swelling, obviously. The marks from the markers will continue to decrease as we go on. Here's the biggest part of the bruising, and then this is the incisions kind of today after 4 months. They are barely visible, so I didn't really take a video because it wouldn't really show anything. It was honestly a pretty positive experience for me. My mom came up to help like drive me and take care of me, which was very nice of her. She was here for a couple days. She made us dinner at one point, which was great. So the first couple days you have pretty limited movement. The pain for me was bad, but like they gave me drugs, so it was fine. I reminded myself multiple times that the pain that I was having post-surgery was honestly not as bad as some of the period cramps that I had experienced, and I would never have to experience those cramps again. So overall, big win on the pain front, because they gave me pain medicine, obviously, and because I was able to compare it to past pain that my uterus had caused me that I knew psychologically I would never have again, and that was really helpful for me. It is very individual. That's how pain tends to be. A couple people asked if recovery included any early menopause symptoms. Once again, because I did not have my ovaries removed, and because I'm on testosterone, so that is the dominant sex hormone in my body, I did not, because nothing hormonally changed about me. Which is great for me personally. Other people might have different experiences. If you're not on testosterone and get your ovaries removed, you might want to look into taking estrogen. I'm not a doctor. Talk to yours. Mobility restriction wise, I was on like bed rest more or less for like 2 or 3 days with walking spurts. You walk around after almost any surgery you get in order to keep your blood flow going to reduce blood clot risk. But I felt back to almost normal after a week. I think 4 to 8 weeks is the typical like exact healing time. I did have pretty significant bruising, not in like a significant / bad way, like in a significant / very normal post-surgical bruising way. They were a bit tender to the touch, but honestly a lot was numb for a while, so it wasn't too bad. I was quite swollen. I looked a little bit pregnant, but it certainly was not bad. I've had worse. You all were here for my top surgery, at least some of you were. Those videos are still up. They're like 5 years old now. That was broadly what the recovery process was like. It was honestly very easy, especially compared to my experience with top surgery. I did have minor spotting for the first 24 hours, which is very normal. It's normal for it to be up to a few days after surgery. Some people bleed a bit more than spotting, but I just had very minor spotting. I wore panty liners for a couple days and then I stopped wearing them and I've been fine ever since. And that's another thing that keeping the cervix is nice for. It reduces your chance of bleeding post-surgery. So shout out to my cervix. We are best friends. I was also asked if anything unexpected happened during the recovery process. Honestly, no. It felt like a normal time in my life. I think a lot of that is because I did an informed consent style. So I was told literally everything I would want to know and given a big packet of every FAQ, and everything was very well explained to me and I was not worried about it. Someone also asked me to compare the recovery process to top surgery. It was so much easier. Nothing like top surgery. I was told not to lift anything over 5 pounds for the first, I think, 3 to 4 weeks. Similar-ish weight restrictions for top surgery, but a shorter time period, and you have pretty much full mobility after 2 weeks, other than you should not have penetrative sex, which I will talk about in a bit because I also got that question. Another common question was, how long is the healing process? It varies based on the type of hysterectomy you get. Because I only took out the uterus, mine was a bit shorter because I had a cervix there, keeping the structure together, you know what I mean? I would say the first 2 weeks were the bulk of it. I felt very normal after 2 weeks, even though my body was still technically healing. And after like 8 weeks is pretty much fully healed. That number might be a bit higher if you get a full hysterectomy, by which I mean one with your tubes, ovaries, and the cervix taken out. It can differ, but for mine, that's what it was. I was asked if there are any emotional changes related to hormones or not. There are none related to hormones because my hormone balance did not change, as we have been over. But emotionally, yeah, I feel better. My baseline of anxiety, I feel like, has gone down a noticeable amount. I feel less anxious about it. I feel more at home in my body. I feel better about the way that I am internally. It's just a much safer and more at-home feeling that I experience now that I didn't have before hysterectomy. Very similar for me to the emotional process of post-op surgery, being like, oh, this is my body now. my chest or my uterus is not something that I have to worry about constantly anymore. And that was a really great feeling, and one that, even though it's like calmer now and I don't think about it all the time, when I do, I'm like, this is sick. I have no regrets. Like, I'm so happy I did this. Kind of in a similar vein, someone also asked, has my relationship with my body or genitals changed because of my hysterectomy? Yes, absolutely. My relationship with my body, for sure. I don't know if it is noticeable to other people, but that doesn't really matter because it's about me in this case, right? It hasn't really changed the way that I feel about my genitals. I really like the changes that T has caused. This was, for me, bottom surgery, right? I don't want any more bottom surgeries. So this is functionally what makes me feel most at home in my genital and reproductive area. That is different for every trans person, but that is where I am at. I was also asked if it changed my relationship. No, I'm also T for T. If I get a gender-affirming surgery and my partner thinks that's weird, that is on them. This is a fun question, kind of. Does it feel weird to be missing an organ? Does it make my insides feel more empty? No. For a little bit, yes, and there was one point where a partner of mine ran their hand over, like, where my uterus used to be and was like, oh my god, you can tell it's not there. And I did. I also did that, and, like, you could tell. However, I think most things in my body have, like, settled. When they do surgery on you, they kind of blow up your abdomen like a balloon so that they can see in there. And, like, after that, you get a lot of cramps because your body's trying to absorb and move that air, which makes sense. But, like, once everything had settled, I would say after, like, 3 to 5 weeks, you can't really tell. If you run your hand over my abdomen, you would not be able to predict whether or not I have a uterus in there. I think some people overestimate the size of a uterus. Most uteruses are under 250 grams-ish. And last question, if you stayed till the end, you get to know my answer to the question, does it impact sex? A little bit, but not in the way that I thought it might, if that makes sense. I don't want to reveal a lot about my sex life on the internet, but in person, I'm very open about it to, like, friends, comrades, because I think transsexuality and being T for T is very cool. If you are under 18 or my family, you can leave the video now. This could still change in the future because I'm only a few months out from surgery, so even though I'm technically fully healed, I'm still, like, kind of cautious. Like, I'm kind of nervous a little bit. Generally, no, it has not impacted sex. It has not impacted how I have sex, how often I have sex, the ways in which I have sex. None of that has really changed due to hysterectomy, although it might for some people, especially if it does make you feel a different way about your body, that could change things for you, and that's totally fine. I enjoy penetrative sex, penetrative vaginal sex. That's a normal thing for people to enjoy, including trans people. I could not do that for 6 to 8 weeks. My doctor told me it would be fine for 6. I waited for 8. I am generally a nervous person. I took my time. Very slowly built up. I still have not taken the size of thing that I took pre-surgery. I think I probably could, but I'm a little bit anxious about it, and I would rather be entirely certain that I'm ready to do something than be nervous about something that I don't need to do to be happy or have a good time. You know what I mean? I hope I've answered all of your questions. If you have additional questions about my own experience or what I know broadly about hysterectomies, feel free to leave them in the comments. I will answer what I can. If you're wondering if there are going to be more videos on this channel at any point, I sure fucking hope so. I have so many ideas, truly, and I would love to do them. I'm only taking 4 classes next semester, so fingers crossed I'll have a bit more time for hobbies like YouTube. If you want, like, a sneak peek, I've been thinking about writing a video essay on the commodification of Keith Haring. I have notes for maybe doing a video essay on anti-capitalist and social justice-oriented fiction, because I recommend a lot of nonfiction books, and people are like, Ashton, I don't want to read nonfiction, tell me more fun things. I also want to do a video on queer comics and graphic novels that I like. Yeah, those are the main 3 that are, like, rolling around in my brain right now, but there are others, always. And if you have requests, feel free to let me know. Will I get to them for the next year? Who knows? But you can sure give it a shot. Thank you for hanging out with me and talking about my uterus and my ovaries and all of the related things. I hope that you learned something, maybe gained some insight into what you want your future transition to be like, or your current transition, or however the fuck that you conceptualize your own transition. And I will talk to you later, maybe.